Hello, I'm Professor Shane Dark of the National Drug and Alcohol Research Centre, and welcome to our series on drugs and the body. Now, in this series we look at a range of different drugs and their effects on individual parts of the body. In this presentation, we're looking at the psychostimulants. The psychostimulants have been one of the major clinical issues really of the last 20 years, particularly drugs such as methamphetamine and cocaine. But before we start looking at what these drugs do to the body, I think it's important we look at what actually are the psychostimulants. What is the group psychostimulants consist of, and what do they do? Well, as the name suggests, they are stimulants. They're uppers in colloquial terms. They increase central nervous system activity and, importantly, cardiovascular activity. And that is something we'll be discussing in this presentation because it's of major clinical significance. They stimulate the release and inhibit the reuptake of neurotransmitters such as dopamine, noradrenaline and serotonin. Now, why do people take these drugs? Well, the acute effects include euphoria, increased self-confidence, and what we call behavioural activation. That is, people are highly activated. Drugs such as the opiates are soporific and people become sleepy. The stimulants, as the name suggests, stimulate people to activity, which can come with harms, which we'll discuss. They're associated with disinhibition. People do things they would not otherwise do, impulsivity, and in some cases, aggression. These are a range of positive and negative effects, and of course, the impact of impulsivity or disinhibition and aggression can have serious consequences. Now, we've looked at the effects that all of the psychostimulants have in common. But what do we mean by this class of drugs? What constitutes it? Well, the major ones of clinical and public health interest are methamphetamine, cocaine and ecstasy. Starting with methamphetamine, it's a synthetic psychostimulant. It comes in various forms, and if we were doing these presentations in the 1990s, I would have been describing powder, which would have been approximately 7 to 10% pure. Since about in this century, there's been an explosion in crystal methamphetamine, which goes under various names, including ice and crystal meth. This is a highly potent form of the drug. As its name suggests, it looks like white crystals, like ice, and it can be smoked or injected. Methamphetamine is a major clinical problem around the Pacific Rim. Countries like Australia, Japan, the west coast of Canada, the United States. The metabolite of methamphetamine is amphetamine. And when I spoke of the powder that was typically seen in the 90s, this was typically amphetamine, and it's a far lower concentration drug. It's again a synthetic psychostimulant. And it can be produced, it doesn't have to be metabolized, it can be produced as is. The next class of drugs is cocaine and the various forms of cocaine. Cocaine differs, it's actually derived from the coca plant, it's not a synthetic. It comes in a variety of forms. Cocaine powder, which may be snorted or injected or smoked. Crack, or freebase, which is highly potent concentrated forms of cocaine. Now that is far more analogous to what we see with crystal methamphetamine, highly potent drugs. Now the thing about highly potent forms of a drug is they have higher dependence potential and they cause more harm. Now the last group of major interest here is MDMA. It's a synthetic stimulant known in various names, ecstasy, E. It can come in various forms, tablets, powders, more recently in crystalline form. It's widely used and strongly associated with dance, party culture. Now, as I said, methamphetamine, very much a drug associated with the Pacific and the Pacific Rim countries, not exclusively, but certainly. Cocaine, very much North America and Europe. You will see a lot more cocaine in Europe than you would methamphetamine, and the reverse is the case in Australasia. Ecstasy is widely distributed throughout the world. We've discussed what the forms of the psychostimulants are. It's time to start looking at the harms. And I'm going to start with psychostimulant toxicity. And what I'm going to describe is true of all of the substances. There are perhaps differences that it looks like methamphetamine is the most toxic of these drugs and has a longer half-life, but they all cause these sorts of potential harms. First is the effects upon the physical system. When we think of toxicity in drugs like heroin or alcohol, we're thinking of depression, of the respiratory depression, etc. In this, we're talking about the opposite. We're talking about the acute effects upon primarily the cardiovascular system. So firstly, an arrhythmia, an irregular heartbeat, tachycardia, which is an accelerated heartbeat. People using these drugs will often feel that their heart is racing, and it is. And it means the heart is under stress. These drugs increase blood pressure, thus there's hypertension. This has effects which I'll discuss later on, but of course it has acute effects that it could cause a heart attack or a stroke, which we'll discuss later. Hypothermia can have high temperatures, like spikingly high temperatures, 40 degrees plus, that can result in what's called malignant hypothermia, and people cannot get their temperature down. And seizures are fitting. These are all the physical effects indicative of psychostimulant toxicity, and I would recommend if anyone is in the presence of someone who's exhibiting these effects, they need medical attention. There are, however, behavioural effects that are of relevance here. In sufficient doses, they can result in delirium, that is a loss of contact with reality, the florid paranoia, which people have heard of in some cases, and that can be, of course, very dangerous. The person thinks they're being persecuted in the absence of any stimuli. And mania, that is, people are completely hyperactivated. As I've said, behavioural activation can be a major issue here, and in this particular cases, delirium, paranoia and mania can put the person at risk for themselves and at risk to others. Now, the toxicity of the psychostimulants has implications for various organ systems. As you would have seen, many of these effects relate to the cardiovascular system. So let's look at psychostimulants in the heart. Firstly, in terms of acute effects, as I've said, the acute effects can be the arrhythmia, an irregular heartbeat, and an accelerated heartbeat. That, of course, can be high risk. An uneven heartbeat can result in a cardiac arrest, and they're indicative that the heart is under stress and the cardiovascular system is under stress. Chest pains, people experiencing chest pains, and for younger people it's one of the major reasons they appear at an accident emergency, and if a young person with no obvious risk factors appears at an A&E, I think you strongly recommend inquiring about whether they've been using psychostimulants such as methamphetamine or cocaine. As I said, hypertension, that can have real effects. The spiking increases in blood pressure puts pressure upon the vascular system, and it can result, for instance, in strokes, which I'll discuss in a minute, or various effects upon increasing the risk of cardiovascular disease. And in some cases, and particularly seen in MDMA, is aortic dissection, that is the splitting of one of the major vessels to the heart, and this is a major medical emergency. And also, there's finally, as you cannot be surprised, this can result in myocardial infarction, that is a heart attack. The person has an arrhythmia, has tachycardia, chest pains, and they have a sudden collapse and are at high risk of dying and need urgent medical attention. Well, they're the acute effects, but what I would like to emphasise here is that the psychostimulants have chronic effects upon the cardiovascular system. This very much distinguishes them from drugs like heroin. The regular and frequent use, but it doesn't have to be regular and frequent, but certainly that increases the risk, results in accelerated heart disease. And what you can see is 70-year-old hearts in 30-year-old bodies. The types of chronic pathology that I'm talking about includes cardiomegaly, that is an enlarged heart. The heart's a muscle. Anything that's affecting it is like this is affecting its ability to pump efficiently. Related to that, left ventricular hypertrophy, that is the left pumping chamber of the heart is thickened, sometimes markedly. And this again reduces the pumping efficiency of the heart. Coronary artery disease, that is atherosclerosis of the coronary arteries, clogging of the arteries with plaque. Those plaques can reduce the amount of blood that can be pulled through them, and thus you get the heart straining and thus enlarging, etc. The cumulative effects of that can result in some cases a complete occlusion of a vessel. All of this can result in hypertensive or ischemic heart disease. That's the effects of consistent hypertension producing the types of things I've just discussed. And ischemia, there's not the oxygen getting through. The heart's working harder to get the oxygen through, and it can result in, example, fibrosis, where there's been oxygen deprivation. And finally, dilated cardiomyopathy, where we see, again, reduced pumping efficiency. Now, all of these are cumulative risks from these drugs. People who use these drugs on a regular basis are likely to develop these types of pathologies, and they can be life-threatening. Now, the effects upon the cardiovascular system have knock-on effects to other parts of the body, in particular the kidneys. You can see, because of the consistent hypertension, accelerated nephrosclerosis, that is a hardening and clogging of the arteries in the kidney. It's as a result of the consistent hypertension, which results in damage to the vessels. You also can see, through a different mechanism, acute kidney injury. Now, that can result in acute kidney failure. That comes from a different mechanism. That comes from, if you remember, I spoke of hypothermia. Now, this can result, and this can be, as I said, very severe, and people will do things like put people in a shower to try and cool them down, and they can't. In such cases, seek medical attention immediately. It can result in rhabdomyolysis. Now, that is what's known as crush syndrome. What it is basically, in this case, the muscles melting. And this results in toxins spreading through the body that can damage the kidneys. This hypothermia also has its effects. It can actually cause liver damage and cause acute liver failure. So when someone's in spikingly high temperatures and clinically significantly high temperatures, there's a whole other range of things that can cause imminent death or certainly imminent danger. And there's also good evidence that these drugs cause direct damage to the liver cells and can actually result in the death of liver cells. Let's look now at the brain, because one of the major effects of the psychostimulants that it's of great clinical concern are their effects upon the brain. I briefly mentioned it before, but stroke is a major clinical issue for users of psychostimulants. The main mechanism here typically is acute hypertension, that is spikes in blood pressure, and this can result in splitting of arteries in the brain. Methamphetamine has a 5 times increased risk for hemorrhagic stroke. And 2 things should be noticed here. One, they are more likely to occur deep in the brain rather than on the surface of the brain, which means that the damage is substantial. And what the second thing is this means is that there are actually poorer clinical outcomes. Whereas about 3% of strokes in younger people, for example, amongst whose these cases typically result in death, it's 30% in methamphetamine users, and the risk of long-term damage is also substantially higher. Cocaine has a 2-fold risk for both hemorrhagic, that is bleeds, and ischemic, that is blockages, strokes. So while methamphetamine is strongly associated with bleeds in the brain, quite often with the development of aneurysms, bubbles in the wall of the arteries, which then break. And if there's a pre-existing aneurysm, then again the increased blood pressure can cause it to break. Again, cocaine shows those effects, but it also causes blockages to the vessels in the brain, and possibly through clogging of the arteries and spasming of the arteries. MDMA, ecstasy, it's less common to see strokes, but there's hemorrhagic strokes, bleeds in the brain, shortly after the use of these drugs has been demonstrated. So all of these have been shown to be effects that can occur quite often shortly after the intake of a psychostimulant. There are some other effects that we need to look at. Firstly, Parkinson's disease. I'm not certain that people are aware that Parkinson's disease, which is a disorder of movement and a degenerative disease, is accelerated by methamphetamine use. There's a 3 times increased risk of developing Parkinson's disease from use of methamphetamine, and there's an earlier onset of methamphetamine-related Parkinsonianism. I think this is an effect that people aren't aware of, and I think they need to be aware of because it's emerging evidence. It's quite solid evidence. The risk of fitting is a major thing. All psychostimulants have an increased risk of seizure. Again, seek medical attention immediately. Serotonin syndrome, which can result in similar effects as an excess of serotonin in the brain. You remember we talked about at the beginning the effects of the psychostimulants on serotonin levels in the brain, can cause confusion, muscle spasms, fixed rigidity of the muscles. This can cause respiratory failure, coma, and even death. And finally, people are probably well aware that you can have transient psychotic symptoms and psychotic illness. Particularly, this is a paranoid schizophreniform disorder. That is, people are delusional or paranoid. And of course, this is at high risk to themselves and others. In some cases, this would usually resolve, but in some cases, if someone has been prone to schizophrenia, this may actually induce the occurrence of schizophrenic disease. Now, there are a range of other problems which I'll just very briefly discuss, because I suppose what I want to emphasise of all the drug classes, the psychostimulants really are the most toxic to all parts of the body. They are remarkable in the range of damage that they can do. In terms of these other problems, firstly the nasal problems, death and septal necrosis and perforation of the septum in the nose from snorting the drug, so that can cause death of cells. It's a vasoconstrictor, and people have literally holes in the septum in the middle of their nose. It's also associated with a range of dental problems. It causes dry mouth, which increases the risk of dental cavities, etc., bacteria in the mouth, and teeth grinding is quite common. So you can also see enamel erosion because they're quite acidic, increased rate of dental cavities, and of gum disease. This can happen from snorting because the acidic substances can come through the back of the nose into the mouth. And there's to use a colloquial term, meth mouth, which is the result, can be massively an example of everything we've just discussed. Missing teeth, serious gum disease, and dental cavities in those teeth that are there. The muscles, I talked of rhabdomyolysis. It can cause permanent damage to some muscles through the hypothermia that can require surgical intervention. Skin, people will feel, it's called formication. They've got bugs under the skin, and you'll have people that will scratch their holes in their skin for these imaginary bugs, which sounds rather, absurd in some ways, but it can be. People will do serious damage to themselves. And finally, gastrointestinal facts that can cause gangrene of the gut, which is exactly as it sounds. So it's death in the colon. As you can see, we've covered a wide range of bodily systems in this lecture, and that's because these drugs actually are toxic to a wide range of bodily systems. This is actually reflected in the fact that you will see that people who use psychostimulants, particularly drugs like methamphetamine and cocaine, are something like 6 times more likely to die than people who don't. Now, all of this is rather complex, and you can see full details in a book we wrote and published in 2021, The Pocket Guide to Drugs and Health, which is page-at-a-glance summaries of the major health effects of all of the drug classes discussed in this lecture series upon each of the bodily organs. I thank you very much for your attention.